Good afternoon, everyone. Welcome to our fall prevention presentation. So I know most of you know me, but those of you who do not, my name is Amanda Bruner. I'm the wellness coordinator and personal trainer here at Westminster. So just a little bit about my education. I have a bachelor's in exercise sports science from Texas State University. Been a personal trainer for 12 years. I've been a part of the Westminster family for the last 3 years, and I'm a certified dementia practitioner.
Hey guys, I'm sure you don't know me. I'm the new program director of the therapy department here at Westminster. A little bit about me, I'm a speech therapist. I got my bachelor's in communication sciences and disorders from Baylor University, and then continued on and got my master's from Baylor as well. I've been a speech therapist for just about 3 years, and I've been the program director for 2 months, so it's going well. I've been part of the Westminster family for about 9 months. So I specialize in cognitive rehabilitation as well as dysphagia management, which essentially is swallowing disorders.
Okay, so what we're going to talk about today is we're going to go over a fall risk checklist. We're going to talk about understanding falls, environmental factors, individual factors, balance, preventing falls, and intervention. So first for our fall risk checklist, and feel free to grab a piece of paper and a pen if you'd like, or you can just keep track of it in your mind. But the first one is, have you fallen before or been injured because of a fall? Yes or no? Do you feel weaker than you used to, or do you have less strength in your arms and legs? Yes or no? Have you stopped doing daily activities or avoided exercise because you're afraid of falling? Yes or no? Do you experience incontinence? Yes or no? Has your hand strength decreased? Yes or no? Has your eyesight diminished, or do you have trouble seeing depth or seeing at night? Yes or no? Do you feel dizzy when you stand up? Yes or no? Have you experienced hearing loss? Yes or no? Do you have foot ulcers, bunions, hammer toes, or calluses that hurt or cause you to adjust your steps? Yes or no? And do you feel unsteady on your feet or shuffle when you walk? Yes or no? So if you answered yes to one or more of the previously asked questions, you could be at risk for a fall. Understanding falls. In 2014, the population of people aged 65 and older numbered 46.2 million. By 2030, the number of U.S. adults aged 65 or older will be more than double, so about 71 million. The age group 85 and older is now the fastest growing segment of the U.S. population. 1 out of 3 older adults falls each year, but less than half tell their doctor. Falling once doubles your chance of falling again. Each year, 2.5 million older adults are treated in emergency rooms for fall injuries. 1 out of 5 falls causes a serious injury, such as broken bones or a head injury. Over 700,000 patients a year are hospitalized because of a fall injury, mostly because of a head injury or a hip fracture. Fear of falling can lead to a spiraling immobility. So, what causes falls?
All right, guys, so one of the main things that causes falls is actually environmental factors. These things are very, very easy to adjust and can save you a lot in the long run. So let's look into these. So some environmental factors could include poor footwear that doesn't fit, cluttering where you walk, such as maybe like your nightstand by your bed or a coffee table in your living room, or just things that are all out and about. Trust me, I have a 2-year-old. I understand that clutter where you walk can cause falls. So poor lighting, making sure that our environment is lit at night, at least like a closet light on, so that way if you get up in the night and you need to go to the restroom, you're able to do so safely. So inadequate walking devices. So what our therapy department specializes in is assessing and administering appropriate walking devices. So if you are not using the appropriate device given your condition, then it could cause a fall. So you might have unsafe steps or walking surfaces, change in texture, such as going from tile to carpet or a rug in your living room, things like that. So movable objects on wheels. So a lot of us, whenever we're walking, sometimes we'll do what we call furniture walking, which essentially means you walk and you grab onto things as you go. Sometimes if we have objects within that reach that have wheels on them, those wheels can slide out and cause some falls there. So unfamiliar settings, not knowing, not being familiar with the environment. So let's think about going on walks. There's always cracks in the sidewalk that you might not be aware of. So just really looking out for those things. Or lack of railing and grab bars. Our occupational therapist specializes in implementing safety railings, grab bars, things like that to make you safer in your environment, such as in the restroom or in the kitchen, things like that. So let's go to the next page here. So another thing that can cause falls is individual factors. So let's look into this. So medications are a big factor. So narcotic, non-narcotic medications, insomnia medications, anti-anxiety medications, antipsychotic medications, heart medications, muscle relaxants, and antihistamines can all put you at higher risk of falls. Now, it's very important to know what your medications are and how they affect you, because if you understand these things, then it can be easier to decide if there needs to be a medication adjustment, and that's something that you can discuss with your physician and should be closely monitoring. Now, I know everybody more than likely takes at least one medication on this list. So those are some important things to look at, because all of these things can increase your risk of falls if not managed appropriately by your medical team. So other individual factors include poor vision. It's very important to get your eyes checked. If you notice decreased vision, definitely something to look into, because it can increase your risk of falls. Decreased strength in your trunk and legs. So as we get older, if we sit around a little bit more, which I know that I would if I were retired, trust me, would not be running marathons. But with that comes some weakness in your trunk and in your legs, which can put you at risk for falls. So decreased flexibility in your neck, spine, and legs can lead to poor posture, which in the end can cause falls. Pain. So if you are in pain, if you have consistent pain, or even if it's just intermittent, that's very important to communicate with your medical team, because if you're in pain, we tend to compensate for that in other ways. So this is the part that's near and dear to my heart, cognitive or memory issues. So a lot of people don't understand that speech therapists can actually address cognitive and memory impairments. So we don't just work on saying your R's and S's like a lot of people seem to think. So we work on attention, memory, problem solving, sequencing, safety awareness, and working on functionally integrating you into your environment to keep you as independent as possible for as long as possible. So it's very important that we have that interdisciplinary approach. You can work with physical therapy, occupational therapy, and speech therapy, all to achieve better walking, better gait, and decrease your risk of falls. So I'll get off my soapbox now. So now we have gait disturbances. So if you shuffle when you walk, if you take small strides, things like that, poor posture when you're walking, that can lead to some falls as well. So other medical conditions such as heart, lung, circulation, nervous system, and incontinence can all lead to falls. So those are important things to look out for as well, and discuss with your medical team if necessary. So balance. Balance is a big one. It's a big one. And we'll talk about that a little bit more in depth here in a minute. And here we are. Look at that cute little elephant. Balance is the key to life. Now, trust me, I'm not going to try to make you stand on a ball like this elephant. Physical therapy, occupational therapy might. So let's look into balance and how this impacts. So How balance works. Balance works by using your eyes to tell you about the environment. Your vestibular system, which is located in your ears, it gives you information about your environment, such as your location in space, the direction and speed of your movement within your environment. It helps keep you upright, and your eyes communicate with the vestibular system. So your eyes and your ears work together to help you balance. So if you have vision impairments or hearing impairments, it can increase that risk of falls and decrease your balance. So your trunk, which is your core, is the foundation for your posture, balance, and coordinated movements. Your trunk can be trained to give a stable foundation for your movements. So if you notice a little bit of trunk weakness, that's something that therapy can address. And a lot of people don't see it that way. A lot of people think, oh, well, we'll just make our arms stronger, make our legs stronger. No, we look at the entirety of the person, mind, body, the whole 9 yards, to determine what the best therapy program is to increase your quality of life. So why would balance be impaired? So if you have your posture deficits, it could be slouching or rounding of the shoulders. It could be how far apart you keep your feet. Sometimes we want to stand with our feet really close together as opposed to separating them a little bit. The wider your base of support is, the more effective and the more balanced you are. So diseases can affect your balance, such as diabetes. And then decreased strength and flexibility and endurance can also affect your balance, as we've discussed previously. So what if your balance is impaired? You can do exercise programs such as Tai Chi or balance programs. I highly recommend remaining active, but also keeping those potential hazards in mind. And the third option, which I prefer, is consult with your therapy team, because we're trained and we have a lot of experience behind us regarding diagnosing and treating these disorders. So, falls can happen. Look at these little guys, aren't they cute? Oh. Mm-hmm. So, doing everything you can to prevent falls can help you live a more independent life. So, we've talked about what can cause a fall. Now let's talk about what we can do to prevent them. So, take care of yourself. If you're feeling weak or dizzy, please, please, please don't get up and try and run a marathon. Check your vision and hearing regularly. Know your medications and communicate those medications with your medical team, as well as your therapy team. Make sure that you have shoes that fit properly, and make sure you're exercising regularly. Okay, so take care while grooming. So as we discussed previously, we can install grab bars, we can look at some non-skid mats, we can do shower chairs, shower benches, long-handled brush or mittens with straps. We can do all kinds of things to help you be safer in completing your ADLs or your activities of daily living. So take care of your home. Watch the doorways, the throw rugs, and the clutter. Repair the loose carpet. Rearrange your furniture if you have to. There's nothing wrong with that. Wipe up spills as soon as they happen. I know I'm guilty of it. I say, oh, well, I'll get that later, and then sometimes I don't. So that can put you at risk of a fall. So check the tennis balls or rubber tips on your walkers regularly. If you need more of those, you can always contact your maintenance department and they can get those reinstalled for you. Keep your house well lit. As we discussed, having a light on at night can save a lot of heartache. So store your frequently used items on low shelves. Whenever we're trying to reach and all of that, sometimes that can put us at risk. If you do notice that you need your items on lower shelves, do that. But also call your therapy department or call Amanda, because those are things that we can help with. And then wear proper shoes, as we've discussed previously. So you can refer to the CDC. They have a checklist. It's called Check for Safety Home Fall Prevention Checklist. And you can just go through, check all the things, and make sure that your home is safe. So take care while outside. It's very important that you use a cane or a walker or your wheelchair as needed. So whenever you're walking or whenever the sidewalks are wet, walk on the grass and use caution when there's inclement weather. So there are several therapy screens that are available. Some of the ones that physical therapy uses, the time to get up and go, the functional reach test, the Tinetti and the Berg. Those are all amazing tests to determine whether or not you're at risk for falls. If you think you might be at risk for falls, or if you just want to get a checkup, consult with your therapy team. And I've put the phone number right here so that you can find it easier. It's 512-454-4711, extension 2642. So if you don't get a chance to write that down, something you can do is you can just call the main line and say, hey, transfer me to the therapy department. Whenever you get the therapy department, you can either ask for myself, Allison Johnson, or you can ask for Hania Mueller. She's our therapy technician, and she'd be happy to assist you. So how can therapy help? We can use comprehensive evaluations within the entire interdisciplinary team. We set functional goals based on everybody and their needs. And we also partner with you, you're our main priority, your family, and your physician to come up with the best approach to help you be successful. So it's important to note that for skilled intervention, a therapy referral from your physician is required. Now, if you refer yourself to us, we can help you with that. We can contact Ann Lipscomb or Kathy Cody. Those are our nurse practitioners in the IL department, and they're very, very good about determining whether or not you're appropriate for evaluation and treatment. So it's very, very easy. A lot of people think, oh, well, trying to get on therapy is really hard. It's not. It's just a phone call and let us take care of the rest. Our top priority is keeping you safe and keeping you healthy and keeping you independent. So therapy can help. We can modify the environments due to low vision. We can help improve that balance or modify the environment to help with that balance. We can help manage that pain through stretching, heat, ice, a whole host of things. We can provide adaptations for your ADLs or activities of daily living. We can help you with some educational pieces as far as how to maintain your memory and your problem solving. And even so far as to we give home exercise programs for the majority of the patients that we discharge to enhance and improve those outcomes and essentially to keep you off our caseload. So we can also work on flexibility and strength. As we discussed before, environmental modifications. We can provide you with the best walking devices that are the safest for you, and we can actually help with incontinence.
So how
you got this one.
How does fear of falling affect you? And so it may stop you from participating in activities and exercise. Inactivity will lead to weakening of the legs, which is imperative in maintaining balance. Inactivity and weakening of the legs will make a fall more likely. So how can wellness help? We have an assessment that we do. So when a resident moves in, I do an initial assessment. It's called the Senior Fit Test, and this allows me to test just figure out your fitness levels, what your limitations are, and things that you need to work on. So I will test your strength for upper and lower body, flexibility for upper and lower body, cardiovascular endurance, and also your balance and coordination. We also offer a ton of exercise classes, huge variety for anyone. Another thing that we have is at-home balance and strengthening exercises, and it's a handout that I created so that you can do a lot of these exercises in your apartment on your own. So our senior fitness test, this is also a test that we recommend you take every 6 to 12 months. Once you have been evaluated, I will make recommendations on how to improve certain areas that need attention and to help prevent falling. And also, like Allison said, we want to keep you all as independent as possible for as long as we can. And then once we evaluate everything, I'll make recommendations, like as far as classes or just things that you might need to work on, whether it's strength or flexibility or balance. And this is all just based on your results, and will help you get into an exercise routine. So some of the exercise classes that we're offering, a lot of them are on channel 1890 right now because of COVID. but we are offering some classes in person in Harris Bell Hall. Here's a list of the classes. We have the Gentle Yoga, Cardio Fit, Better Balance, Total Body Blast, Senior Strong. Those are all in Harris Bell Hall, and I am the one instructing all of those right now. And then I also have the Aqua Conditioning, which is in the Aqua Center. And all of these classes, except for the Aqua class, you do have to sign up in the activity book in the Preston lobby. We're keeping the classes at a max of 10 residents, and you are required to wear a mask if you come to the class. We also practice social distancing during the classes. So reminders about the exercise classes in Harris Bell Hall. Like I said, you must sign up in the activity book in the Preston lobby to attend any class in Harris Bell Hall. We are allowing only a max of 10 residents per class. You're required to wear a mask and practice social distancing during the class and even before the class when you arrive and after. I am disinfecting all the exercise equipment and all the mats after each class. So the exercise classes that we have on channel 1890, this is our in-house channel. I think most of you do get that channel. If you do not, and you would like the channel, or if you're having any issues with it, please reach out. You can call the front desk and they can transfer you to Larry or Danny in the IT department, and they can get that set up for you or make sure it's working properly. So the classes on channel 1890 that we currently have are the beginner ballet. We have our resident-led chair exercise, which is led each day by a different resident. We have our gentle exercise with Leah or Brooks. We have Tai Chi. We have better balance, Pilates with Cindy, line dancing with Sonia, and then I have a stretching class. So the at-home balance and strengthening exercises, this is a handout that I created that I mentioned earlier. It's titled Stop the Fall. It's a list of 7 lower body and balance exercises for you to do in your home, or you can even come to one of the gyms if you like to get out of your apartment and do those in the gym as well. You can find this handout on the tables in the Preston, the Windsor, and Arbor lobby, or in the Preston gym on the ground floor. So as far as the exercise class schedules, you can find that in the monthly newsletter. Those are put in your mailboxes every month. We also have a weekly calendar that is located at the front desk, all the front desk, and that'll have the exercise count or the exercise schedule on that as well. We have a daily calendar that's located in all of the elevators. You can also find the class schedule handout in the Preston gym and the Annex gym. We have that class schedule also listed on our resident portal. And then in the tables in the Preston, Windsor, and Arbor lobby, there is an exercise class schedule handout. So we have that schedule in a variety of locations. Okay, so we're going to end this presentation with a little myth buster. Falls are an inevitable part of getting older. So what do you all think? Falls are an inevitable part of getting older. Do you think that's a myth or a fact? The truth is, falling is not a normal part of aging. Actually, weakness and poor balance are linked to inactivity rather than age. Our risk of a fall decreases with this one simple thing. What do you think that is? Exercise. Exercise, exercise. Exercise is a key approach to decreasing falls. All right, so if you have any questions, or information on exercise or balance or any of the exercise classes, please contact me, Amanda Bruner, the wellness coordinator here. My phone number is 512-454-4711, and my extension is 2295. You can also reach me via email, amanda@wmanor.com.
So for more information on falls, therapeutic evaluations, whether it's physical therapy, occupational therapy, or speech therapy, you can contact me, Allison Johnson. I'm the Rehab Care Program Director. My phone number is also 512-454-4711, and my extension is 2642. You can also reach me via email. It's allison.johnson@rehabcare.com, and it's ALYSON. Most people don't spell it right, and then they get mad because I don't respond. So ALYSON.johnson@rehabcare.com. And another important thing to note, I don't think I mentioned it earlier, our therapy team is doing in-room treatments. So as of right now, our therapy gym is closed due to COVID, but our staff is taking very, very high precautions in order to keep you guys safe. And we do everything in the home or around the hallways, maintaining social distancing with other residents. So we can take care of you even through the COVID times.
Okay, so if you would like to look over this presentation again, you can find it on Westminster's resident portal. All right, thank you all for joining us for our fall prevention presentation. Have a wonderful afternoon.
Thanks, guys.
Thank you. Stay healthy. Thank you all.